Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I'm here with Commissioner Ken Lawrence, and today is Wednesday, July the 15th. Thank you for joining us for our afternoon press briefing. We are in week 19 here in Montgomery County of the COVID-19 pandemic, and we are in week 3 of the green phase of the governor's reopening plan. Since the July 14th press release, we have had 59 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 8,861. These positive cases are a result of a positive test for the virus, not from the antibody test. All 59 of these cases today are from the community. 41 of these tests were conducted between July the 1st and July the 10th. And I will speak to the unacceptably long test turnaround times later in this briefing. These positive individuals are from 29 municipalities. 61 of our 62 Montgomery County municipalities are home to individuals with COVID-19. These individuals range in age from 1-year-old to 72 years old. And as always, you can check our county map found at www.montcopa.org/COVID-19 for updated geographic information. Today we have 36 females and 23 males. I am pleased to report that we have no Montgomery County deaths to report today. So that leaves us at 811 deaths confirmed positive from COVID-19. Overall, there have been 431 females and 380 males. The racial breakdown, as we have it, is 18 Asian, 3 Asian Indian, 3 Asian Korean, 99 African American or Black, 315 white, and 373 unknown. In terms of long-term care facilities, we are at 672 confirmed positive deaths of the 811 total confirmed positive, which accounts for 83% of the lives lost to COVID-19 here in Montgomery County. The hospital bed situation continues to slowly improve. Today, we have approximately 58 patients hospitalized with COVID-19 in Montgomery County hospitals, with 11 individuals requiring a ventilator. That's approximately 19%. At our Montgomery County Correctional Facility, we received word late this morning that a single inmate at the facility has tested positive for COVID-19. This individual is not included in the count of 59 positive individuals already mentioned because we received it after our cutoff point, but we wanted to share it with you. Investigation of this case indicates that the individual became infected with the coronavirus prior to entry into the Montgomery County Correctional Facility. This individual has been in isolation since entry into the facility and is currently stable. Since the President Judge issued the initial March 12, 2020 order declaring a judicial emergency, the population in the Montgomery County Correctional Facility has gone from 1,342 to 856 today, a net decrease of 4,086, which is a 36%. Since March the 13th, there have been a total of 1,384 discharges, and the average number of daily commits is 5 to 6 per day. That compares with 28 per day prior to the March 12th emergency order. Moving on to community testing, as a reminder, the county now has 6 COVID-19 testing sites open around the county. None of these sites require a car in order to be tested. These sites do require an appointment. We also require that the person being tested is a resident of Montgomery County or works in Montgomery County. These county-run sites provide testing at no cost, though insurance will be billed if you have it. They do not require a healthcare provider's order, and we will test individuals of any age who want or need to be tested. The cost of these sites is being covered by CARES Act funding that has been allocated directly to Montgomery County. The test sites are open and the hours do vary each day, so be sure to check the website. The sites are in Pottstown at the Montgomery County Office of Public Health, 364 King Street in Pottstown, Lansdale, 421 Main Street in Lansdale, the Willow Grove Office of Public Health, which is 102 York Road, Green Lane, which is at Deep Creek and Snyder Road, Ardmore at 114 West Lancaster Avenue, and Norristown at 1401 DeKalb Street at the Delaware Valley Community Health Center. And we want to thank them again for being such wonderful partners in this work. To make an appointment for a test, online registration is available for all of the sites at www.macopa.org/COVID-19 under the green County Testing Information button. Appointments open at 8:30 a.m. on the day of testing. Now, one note about the online registration site. When you go on there, depending on the time of day that you go on, you may see a message that says, "This site is closed for testing tomorrow." Please ignore that message. That is a glitch in the system. It has to do with making sure that people can only register for tests on the day that they're requesting the test. So we're trying to get that fixed, but that's caused an awful lot of concern. So the tests are open every day, weather permitting. These sites are somewhat outdoors, and so we do close if the weather is severe or is forecasted to be severe. But other than that, you can ignore that message that is on the website. You can also make an appointment by phone. The number to make an appointment at any of the sites is 610-970-2937. And that also opens at 8:30 in the morning for the day that you would like to be tested. Our phone lines do have Spanish-speaking operators in many cases, or language line immediately available, and the language line has multiple languages available. Now, about these testing delays. As a number of individuals have experienced, it can take 7 to 10 days for test results to come back. This is a serious and very frustrating situation that is occurring across multiple lab companies. Earlier today, I had a call with Quest Diagnostics, who is running the tests for the county. I expressed my deep anger and frustration with this situation and conveyed to them that this is unacceptable for the residents of Montgomery County. They attribute the delay to their labs being at capacity, given the explosion of new cases across the United States. They are working to expand capacity, which includes purchasing and installing additional equipment to run the tests. However, this slow test turnaround time is unacceptable. And while the county will continue to work with Quest for now, we are actively exploring other reliable labs. And if we are able to find another vendor that we believe will give us a consistent and reliable turnaround time, as well as a reliable test result, we will consider switching labs. I do want to say, though, that I believe Quest when they say that one of their biggest challenges is the amount of testing that is happening all around the country right now because of the explosion of virus in so many states. And that this is a reminder of how we are all in this together and how actions of individuals, even in other parts of the country, are negatively impacting us here in Montgomery County. Together, through substantial shared sacrifice, the people in this county have dramatically reduced the viral spread here in Monco. But this is no time to let up. So let me show you where we are today, which continues to be in a good place. So these are graphs that we show regularly. We're going to start with our date of test graph, and this shows the daily cases, and that's in the gray bars in the background. So those are the total number of daily positives in the gray bars in the background. And then the 7-day average and the 14-day average of these positive tests. So the red pink lines are the 7 and 14-day average for the entire community. The blue lines are the 7 and 14-day averages for just community members. And the orange and yellow lines are the 7 and 14-day running averages for individuals in long-term care facilities. So we've got a zoom in of this graph since this is getting a little hard to read because the graph is getting so big. And I just want to share with you some of the data. So on on our July the 1st graph, which was data from June the 26th, our total 7-day average was running 35.9 positives. And today, this is data through July the 10th, we're now running 25 in our 7-day average, and that's for the entire community. For just cases that are in the community, we were 32.9 for the 7-day average on June the 26th, and today we're at 23.7. And by today, I actually mean July the 10th. And then for our long-term care facilities, on June the 26th, our 7-day average was 3, and on July the 10th, it was down to 1.3. So this is good news. We continue to be moving in the right direction, but again, we don't want to let up. Our other graph, which is also extremely important that we like to share with you regularly, is our overall positivity. And this gives us a sense of what's happening across the entire county and helps to correct for the number of tests that are done every day. So this graph runs through July the 10th. The orange, very jaggedy line is the total number of Montgomery County residents that were tested on any given day. And again, this is through July the 10th. And then the blue line is the percent of those residents that were positive. So this is data as best as we can get it on any person who has a Montgomery County address as their home address who was tested on that given day, and what percent of those individuals were positive. So as of July the 10th, we are running at 3.3%. This is a very strong number. This is an amount of virus in our community that if we can keep it this low, we can live with. This will help us in terms of getting our schools open this fall and keep allowing our businesses to be able to stay open. So this is good. However, I have to give you some, real cautionary stories here. And some folks on my contact tracing team, our county contact tracing team, shared these stories with me yesterday because of their very, very deep concern for the lack of cooperation from some individuals in our community with the contact tracing process itself, and then with the isolation and quarantine orders that they're being given. So the first story involves a youth sports league coach who tested positive for COVID-19 and was coaching during the infectious period, coached several games. And this individual acknowledged that they did not always maintain social distance and did not always wear a mask. So because of that, working with the president of the league, the Office of Public Health recommended that 12 players and all 3 coaches that were involved be quarantined for a 14-day period. Now, through that contact tracing with the positive coach, our team also learned that the coach had several household exposures, which we always expect, and the coach attended a July 4th party, also during the infectious period. However, they were unwilling to give us the names of the people that were also at that party. And so because of that, our contact tracing team was not able to notify these individuals that they had had direct contact to somebody who was positive for COVID-19. However, as is often the case, the rumor mill started, And so our office started to get phone calls from people who had been at that party saying that they had heard somebody there was positive. But because we weren't given the direct information, our contact tracing team couldn't confirm one way or another. We try to make this information as reliable as possible. So that was deeply frustrating for everybody involved. We also learned that there were parents who, even though their children should have been in quarantine, took their children to play in other sports leagues games. So these are the types of activities that when you see these big outbreaks in some of our other states, this is how this happens. You have somebody who's a positive individual, they go to a party, they don't share with our team who was at that party, so we have no way to contact those people and tell them to quarantine. Or we have people that are just simply defying the orders to quarantine, even though they know with certainty that they were directly exposed to the coronavirus. The second story I want to share with you is about a large graduation party. Our Office of Public Health was notified of a large graduation party at the end of June that had over 100 people in attendance. They were not practicing social distancing or masking. It was identified that some attendees were sharing drinks out of the same glass and sharing vape pens. Several positive cases have been identified as possibly being infected at this party. We believe there are probably other cases from that party, but they have not admitted to being at the party. We also believe that many people were potentially exposed at that party, but we have not been able to notify them because no one has been willing to share the names with us. The cases that we know are positive have resulted in spread and exposure to groups that have included first responders, pool lifeguards, and other groups who have regular contact with the public. So these are really serious problems. Non-cooperation with contact tracers can result in outbreaks that are substantial and can infect many, many, many people in our community. So again, I say, we are all in this together. And if you test positive, please cooperate with contact tracing. We do not reveal who the positive individual is, but it is imperative that we find out anyone that you may have exposed, even accidentally, as best as you can remember, so that we can make sure that those individuals are warned and that they can take steps for themselves to protect their families and their coworkers and anyone else that they might come into contact with. As I've said many times, although we're in the green phase, green does not mean to go back to what your life was like before the pandemic. Green means carefully and cautiously moving forward to our new normal of living with this virus for the foreseeable future. And we have goals in this work. We would like to make sure that our schools can open up this fall so that parents that would like to send their children back to in-person school are able to do that. We want to support our local businesses that have opened responsibly and have invested a lot in trying to do that and are just starting to get back on their feet. The last thing we want to do is be in a situation where we would have to ask those businesses to close again. And the way that we are successful in doing this is to keep the amount of virus circulating in our community as low as possible. This protects all of us as well as our hospitals and first responders. Everyone has to remember that the decisions that people are making today will manifest fully 4 to 6 weeks from now. That's just how long it takes for the disease to spread sufficiently to really impact a large number of people. And that will be right when our schools are trying to open back up for our kids to go back. So please, number one, wear a mask every time you leave your home. On July the 1st, the Secretary of Health issued a universal face coverings order. This order mandates the wearing of a mask with very few exceptions inside all public places. The mask must be kept on covering both your nose and your mouth the entire time. you're in that place of business or other public place inside. It also requires wearing a mask outside. Again, with very few exceptions, if you're not able to consistently maintain social distancing. This order was issued because universal mask wearing, even a cloth mask, has been shown to decrease the spread of the coronavirus. So please don't leave home without a mask or a face covering. Even if you're just going out for a walk or a run in your neighborhood, take a bandana or mask and just tie it around your wrist. And that way, if you run into a neighbor or someone you want to have a conversation with, you can just quickly put that on. These are simple things, very simple things. And by taking these steps, you'll keep everybody safe. You'll keep yourself safe, your family safe, any person in your life that you love or care about that's at risk for serious complications from COVID-19. Please just wear a mask. And that's my reminder to tell you and remind you about the Mask Up Montco campaign. We have these free posters that you can easily download from our hub website and ask businesses to post them and others to post them on social media. Please, let's get everybody wearing a mask. Also, just want to remind you to continue to maintain social or physical distancing of 6 feet. Keeping that 6-foot distance and wearing a mask, it shows to be the most successful in decreasing the spread of the virus. Keep those hands clean. You know the drill. Wash your hands with soap and water for 20 seconds or use hand sanitizer if soap and water aren't available. And if your hands aren't clean, try as hard as you can not to touch your eyes, your nose, or your mouth. If you are worried that you've been exposed or you're having symptoms, please get tested. The more we test, the more we know. And then, of course, cooperate with contact tracing. These are not difficult things. They might be a little inconvenient or a little annoying, but they are relatively easy to do. And by doing this, you'll keep yourself and your family, your loved ones, your friends safe. And you'll also help our whole community stay open and looking forward. And with that, I will turn over to Commissioner Lawrence for a couple of updates. Thank you.
Okay, good afternoon, everyone. Today, I am announcing round 3 of the Montco Strong Small Business Grant Program. Last week, the commissioners approved another $10 million for round 3 of this small business grant program, which is to help small businesses who are suffering losses during the COVID-19 pandemic. Thus far, there's been $6 million awarded to 480 small businesses in Montgomery County during the first 2 rounds. And the $10 million available for this 3rd round is coming from the Federal CARES Act. Round 3 awards will once again be administered by the Redevelopment Authority of Montgomery County in partnership with the Montgomery County Department of Commerce. Applications will be accepted beginning approximately at 10 a.m. tomorrow on Thursday, July 16th, and the application window will close at noon on Friday, July 17th. This is not a first-come, first-served program, so if you don't get your application in at 10 a.m., you just want to make sure you get it in before it closes on Friday, July 17th. And applications and guidelines are also available in Korean and Spanish. Eligibility will be based on the following criteria. You must be a for-profit business with a physical location in Montgomery County that was in operation on or before March 23rd, 2020. You must have experienced disruption due to the COVID-19 global pandemic, meeting the following criteria. Employed and paying no more than 50 full and part-time employees as of July 1st, 2020. Subcontractors and or 1099 employees should not be included in the employee count. You cannot be a publicly traded company. And unfortunately, nonprofit organizations are not eligible for the program due to the regulations of the CARES Act as it relates to providing small business assistance. Businesses that received round 1 or round 2 Montco Strong Small Business Grants may not apply in round 3. Applicants from round 1 and from round 2 should apply again Your applications from the prior rounds do not carry over. So if you've applied and did not receive funding, you will need to apply again. And for more information and to apply, you can go to www.montcopa.org/MontcoStrongSBGP. And once the applications have been fully reviewed, grant awardees will be contacted via email by the Redevelopment Authority of Montgomery County. A list of all the previous awardees from the first two rounds is available at the same website, www.montcopa.org/MontcoStrongSBGP. And as always, we would like to extend our thanks to the Redevelopment Authority of Montgomery County, their staff, and their board for their partnership with our Commerce Department to provide this valuable assistance to the small businesses of Montgomery County. Thank you.
Thanks, Commissioner Lawrence. All right, with that, happy to take any questions.
Thank you. This afternoon, we're joined by Kevin Tierney from Burr Media, as well as Deanna Durante from NBC 10. We will start our questions with Mr. Tierney.
Hi, thank you. Has there been any tests connected to camps or daycares that have opened so far? Positive test.
I am aware of one child with a positive test connected to a daycare. I am not aware of any positive tests connected to any camps.
Is there any process in place between, and this might not be the right question for you, between the camps and daycares and the school districts to kind of say this is what happened when we actually opened, to kind of offer some advice and best practices as schools move to open?
Yeah, I don't have an answer for that. Our Office of Public Health is working directly with our school superintendents on their reopening plans, and so I'm very involved in that work. But I don't. So what I can say is the school superintendents are speaking regularly with one another, but I don't know if there's any communication between camps or daycares.
Okay, one last one. If someone tests positive and then is tested like a month later to see if they still have it, are they counted once or twice in the overall countywide number?
Well, they're counted as a test every time someone is tested. So they are counted as a test. And some people do test positive a second time. And we do try to clean that up. If it's a duplicate positive, we do our best. Sometimes people do get tested that second time and test negative. So that test would be counted, but obviously they wouldn't be counted as another positive.
All right, thank you.
Mm-hmm. And by the way, Kevin, that's a relatively small number of people. We've tested now nearly 100,000 people in the county. In fact, we might have even crossed 100, where if we didn't, we're about to. And those people that have been tested twice is a very, very small number, not enough to impact our data in any way.
Thanks, Kevin. Next, we will turn it over to Deanna Durante.
I wanted to follow up on what you're talking about with the contact tracing. The coach in question here, the coach cooperated or did not cooperate?
I would characterize it as partial cooperation. Thankfully, cooperated to the extent that the individual acknowledged that they had not been wearing a mask continuously and had not consistently maintained social distancing from the players and other coaches. So based on that, we were able to put that team into quarantine. Then there was a breakdown, though, with attendees at a party that the individual attended apparently while having symptoms, or at least known to be positive.
So then, since people don't want to cooperate, can you tell us what town this party was in?
I don't actually know. I'd have to go back to my team to find out.
I'm going to put in a formal request for that one, and then the other party, the graduation party, if you could tell me what towns they're in. But I also wanted to ask you about what's on every parent's mind right now, what schools look like. You go to any social media page and everybody's asking, what's your school plan? Has the school announced? And you say that you're involved with all of the school districts, but all of the school districts won't have the same plan, or will they?
So let me tell you what's been going on. For weeks now, myself and some members of our Office of Public Health have been meeting once a week, sometimes more, with the school superintendents. It's a regular meeting that they have organized by the Montgomery County Intermediate Unit. And we have been working collaboratively with them to develop guidance for our school openings. And I want to say at the outset that the superintendents have been real heroes in this work. They are working so hard to make their schools as safe as possible. And it is a real challenge across the board. I don't care what school district you live in. Every school district has schools with classrooms that are very tight, and it's going to be very challenging in some of those rooms. I also want families to start to really understand that there is no way possible to guarantee that any school will be free of the coronavirus. In fact, I think everybody needs to start to sort of let it sink in that there will be coronavirus cases in our schools throughout this school year. And the goal is to make that situation as limited as possible and keep those schools as safe as possible while getting the benefit of in-person education. And we know, particularly for younger students, how critically important that is. So we've been working with our superintendents to put together a set of guidance. We are hoping that we will release it by the end of this week. We have been dragging our feet a little bit because we expected that the state Department of Education and Department of Health were going to release guidance, and we were hoping that we could see that before we released ours. I have yet to see that guidance. It has not been released, and so we're going to release ours by the end of this week, regardless. And I just think that every family is going to have to consider their personal circumstances. So families will need to consider the health of their children and whether or not their children have any underlying conditions that might make exposure to the coronavirus a more serious situation. They'll want to look at the situation in their own homes and who's living in that home. If they have maybe an elderly relative that lives with them that could be at risk. And then their own personal work situations. So this is going to be a balancing act for every one of our families. And each family will have to decide what is best for their own family. But I can tell you that our schools are doing everything they can to make the situation within each school as safe as possible. And that will look different, even from classroom to classroom in some schools, depending how many children are physically present in a class and how big individual classrooms are. They are all being really innovative. They're using gymnasiums and auditoriums and all kinds of alternate spaces. They've cleaned out classrooms. So they could keep desks as far apart as possible. They're doing a lot of things, but we know how contagious this virus is. And so there's no way that anybody can say that there will be no cases. And all of that ties back into this work that we've been doing to keep the spread of the virus as low as possible in our community right now, because that will just make the risk in the schools and our businesses, any place, that much lower.
But the governor's doing his news conference right now in Harrisburg, in which he's reducing restaurant and bar capacity and limiting all indoor gatherings to 25 people or less. Most schools have more than 25 people in them.
Yeah. It's my understanding that that language does not apply to schools.
Okay. Are you disappointed that there's been a lack of guidance issued to the counties from the Department of Health and the Department of Education?
I am disappointed because I think that the more that we work together on this, the better. And what I mean when I say that is that as I said many, many times before, this virus doesn't respect county lines or municipal lines or school district lines. And so the more that everybody is working together and moving in the same direction to make our schools and our communities as safe as possible, the better we all do. So I think it would have been very helpful if we could, and hopefully we will still get some guidance from them, but it would have been nice if they could have shared that sooner.
Thank you.
Thank you. Any other questions, Todd?
We have no further questions today.
All right. Then in that case, thanks to Megan, and we will see you all next Wednesday at 3 p.m.